Hi everyone, this is Dr. Amir Rajavi, veterinarian, Montreal, Canada. Today we're going to talk about vaccination for kittens and also for adult cats. There will be other videos about vaccination for puppies and also for adult dogs, which will be released in the following weeks. Uh, First of all, I would like to emphasize that these videos there are not a replacement for the veterinary visit and consulting a veterinarian, because only a veterinarian or the qualified veterinarian who is able to assess your cat's health and physical situation and decide about giving a vaccine or skipping the vaccine for that year. The instructions or the guidelines that we follow here in North America is normally based on the guidelines of the American Animal Hospital Association, or the abbreviation is AAHA. Based on that, as I said, there's always a physical exam that should be done at the same time with vaccination to evaluate the health status of the patient. There are several factors that we need to consider for vaccinating cats or kittens. Number one is the age. As you may know, kittens are always more susceptible to infectious diseases comparing to adult cats. And the other factor will be the lifestyle of the animal. If we have a cat which is outdoor cat, indoor cat, indoor with like in a multiple cat household, or just a single cat living with a senior person. So all that, they can change the vaccination protocols and necessity. And the last important thing is the prevalence or the presence of the certain viruses or pathogens in the area that you're living. So these are all, they make it necessary to consult a veterinarian before giving the vaccine. So we have two targets normally for vaccination. Number one is to prevent the contamination of or the circulation of the infectious disease between cats, and the other one is to try to reduce the risk for zoonosis disease, or the disease common between the human and the animals. For kittens, always for the kittens that they're born from the vaccinated queens or vaccinated mothers, they have a maternally derived antibodies. These kind of antibodies, they come from the colostrum, or the milk that they drink in the first 24 to 36 hours. And normally the most important part of the absorption is in the first 24 hours after birth. So this is a very good immunity. This can keep them away from the harmful pathogens for at least 4 or 5 weeks, and at the same time it can interfere with our vaccines or with vaccine efficiency. So this is the reason that we need to sometimes we need to repeat several times the vaccines. Sometimes I have the clients that they are not aware of the repetition of the vaccines, and also they are not aware of necessity of physical exam with each vaccine repetition. So this is very important to consider. We have different types of vaccines in terms of production. We have inactivated vaccines, which are killed viruses, and we have attenuated live vaccines, and also we have recombinant vaccines. So each of them, they have advantages or disadvantages. The kill vaccines, they don't cause any active pathologic mechanism. Okay, so the only thing that they do is that they stimulate the production of antibodies against that virus. The live or attenuated vaccines, because they're live viruses, they can cause sometimes the pathological procedure is very rare, and also they're not recommended for the for the pregnant queens or pregnant female cats. The vaccines that we give, we have two types of vaccines. We have core vaccination and we have non-core vaccinations. Core vaccinations, as you may know, they're more essential. So we have the combo of feline parvovirus or panleukopenia. We have feline herpes virus, and also we have feline calicivirus. So these three normally are in just one single shot, and these vaccinations can be started from 6 weeks of age, and then we can continue. Then we can give the boosters every 2 to 4 weeks until 16 to 20 weeks. And then after that it will be 1 year. Right now there are some studies that they show that if we give the booster in 6 months instead of 1 year, probably we can have a better immunization level for kittens. The other vaccine which can be considered core for the cats under 1 year of age are the vaccine against the leukemia virus, which we need normally 2 doses, 3 to 4 weeks apart. And the last one is the rabies shot, which we don't need a booster, and it will be given, for example, today, and then in a year, and after that every 3 years. The non-core vaccines, it's really related to lifestyle and geographical distribution. Vaccination against chlamydiosis or against the Bordetella, which is a respiratory disease. Normally we don't have them in Canada, and we don't recommend them. So after that, most of the time it is recommended that we continue the vaccines until at least age of 9-10 years old. For sure, based on the lifestyle for cats that go outside, it's always good to continue the vaccines until they go outside. For rabies, for the base vaccine, the core vaccine, and also the combo vaccine and the leukemia. But there are some reasons that we consider stopping the vaccination. One of them could be the age of the patient, the other one could be the health status of the patient. So this is something that the pet owners, they should discuss with the veterinarian, and that's a decision which should be made together. The other thing which is very important is about the possible vaccinal reactions. There could be some, always there could be. The vaccines that right now they're available at the market are very, very safe, very secure, but there's always a possibility, we always have exceptions. There are some side effects which are considered minor side effects, like maybe a bit of lethargy or inappetence, losing of appetite, or for example some swelling, minor swelling in the site of injection, which normally goes away after 2-3 days post-vaccination. There are some more severe or serious reactions like vomiting, diarrhea, respiratory distress, and even like shock, swelling in the face, in all the body. So these type of reactions are not normal at all. So if, for example, you encounter this kind of situation, it's very important to take the patient right away to the hospital for the necessary injections. For the patients that they have this kind of reactions in their history, based on their situation, if it's needed to continue the vaccination, for sure we will continue, but we can give 1 dose of glucocorticoids or anti-inflammatories plus a dose of antihistamines before the vaccination, like 20 to 30 minutes before the vaccination, to make sure that it does not happen again. The last thing that I would like to discuss before finishing this subject is about the lumps or masses or sarcomas, which are related to the which comes in the injection vaccine sites or vaccinal injection sites. So normally when you see a bump a few days after the vaccination, which kind of hard and movable, and it's noticeable. So we have a rule. We can use the rule of 3-2-1. which is number one, if the mass or the bump or the lump is still persisting 3 months after the vaccination, so this is something should be considered important. Number two, if the size or the diameter of the lump is 2 centimeter or more, this is something should be considered serious. And the last one is that 1 month after vaccination, if you see that it's growing bigger than normal, so and growing fast, this is not normal, absolutely. So in these kind of cases, we need biopsies or excisional biopsies or final aspiration to check the contents by cytology or by histopathology test. So for the adult cats, normally for most of the vaccines, for the trio vaccine or for the combo vaccine, herpes virus, panleukopenia, and calicivirus, normally we need just 2 doses, 3 to 4 weeks apart. For the leukemia vaccine, we need 2 doses, again 3 to 4 weeks apart, and for the rabies, we need just 1 dose. So it's the same principle for the adult cats as well, based on the risk, based on the environmental presence of the pathogen and lifestyle. We need to decide about continuing and about the age of the patient. We need to decide to continue to continue or not the vaccine. I think that's it for today. So I'm going to say another video about the vaccination for puppies and adult dogs very soon. Okay, until then, bye.